Hello, I'm Dr. Lewis Hassel. I am a professor of pathology here at the University of Oklahoma Medical Center in Oklahoma City, Oklahoma. And I'd like to chat with you just briefly about a couple of significant things that I have seen in my practice that are derived largely from preventable causes, causes that arise from decisions often begun when someone is very young and death and disease seem a long ways off. I'm speaking about the health consequences of smoking and using tobacco products. This is one of the reasons why I've been able to um, keep busy and have plenty of work to do, is because tobacco is such an addictive drug and so harmful that the number of effects it has on the body are truly remarkable. One of the most remarkable and significant ones is in the lungs, where, as you know, smoking is the leading cause of lung cancers. Now, that's not to say that every lung cancer is caused by smoking, because certainly there are other forces that can create that circumstance. But the most common one, and certainly the most preventable one, is smoking. And one of the reasons this is so difficult is that smoking often presents lung cancers often present with fairly advanced stage, large tumors, nodal metastasis, spread of the tumor to other areas of the body. Because your lungs, as you see here in the middle of your body, have a tremendous amount of reserve capacity. And the growth of a mass here can go along for a long time before it's noticed or becomes significant. It can push apart the normal structures, and this is what it looks like. Cancer grows in an uncontrolled fashion and pushes aside the normal structures, here the lining of one of the airways, to make their own way in the world. And they don't have respect for one another. So that's one of the things that I certainly hope that you will avoid, is to give up smoking quickly. Another thing that has kept me busy from time to time is doing autopsies. This is a picture of the heart. And as you can see, this patient is no longer alive. And the reason they're not alive is because of a heart attack, which, as you see here, is this very significant scar occupying about a third of the muscle, weakening and thinning the wall here between the two ventricles and making it harder for the patient to get proper circulation. Well, what happens with heart attacks is that smoking can accelerate the deposition of fatty deposits and other debris in the small vessels of the heart. And as that happens, the muscle becomes starved for oxygen or essential nutrients. And then something sometimes happens in one of these, what we call plaques, that makes it so that the plaque ruptures and there is a complete blockage of that little vessel, leading to death of some of the heart muscle cells. Now, if the patient survives for some time, that may look a little bit like this, where the tissue scars down, and rather than being dead because it ruptured or something like that, the patient is just significantly handicapped. They can no longer ride their bicycle as fast. They can no longer walk as far. They can no longer climb stairs, those kinds of disabilities. But the remarkable thing about both of these disorders is that if you quit smoking, your body has a great capacity to repair itself, and your risk of developing these diseases goes down. So if you compare those who have never smoked to those who stopped smoking at age 30, there's not a huge difference. But when you compare those who have never smoked to those who are continuing to smoke, you see that the cumulative risk is 6, 10, 15 times greater by the time you reach age 70. Similarly, if you stop at a later age, 60 or even 50, your risk will be lower than it would be if you continued to smoke. So at any age, choosing to stop smoking is a good choice. Now, I know that many people these days have made recommendations that people use nicotine products delivered in other fashions to help them to stop smoking. And one of the most common of these is so-called e-cigarettes or vaping. But this is really not a great way, not a great alternative to smoking. Because in fact, the substances that are in e-cigarettes, the solvents, the chemicals, the nicotine, continue to have adverse effects on the body, on the heart. They have the potential to cause cancers. They have the potential to cause serious toxic lung damage and pneumonias, neural injuries, and other problems as well. So using perhaps a nicotine patch or some such substitute for a short term until you have developed the ability to wean yourself off of that substance is far better than using e-cigarettes, thinking that this will be healthier for you. It may have a small marginal effect, but it introduces a whole host of new possibilities into your life. So that's my commercial message. Why do I want you to do this? Well, I don't want to be doing your autopsy at age 30 or 40. I don't want my children to have to look at your lung cancer when you develop that prematurely. Or even more so, I don't want your children or your spouse to be left a widow or fatherless because of early death due to tobacco. So take my advice, stop now, and you'll be happier, you'll be healthier. Your risk of cancer, heart disease, and a whole host of other diseases, cancers and non-cancers alike, will be diminished. So that's my message, and I'll stand by it and wish you all the good fortune in making good choices with your body and your health. Thanks for listening. Talk to you again soon.